Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. Welcome to this week's episode of the Healing Pain Podcast, the show where we explore the dynamic world of chronic pain, neuroscience, physical therapy, and the opportunities for transforming how pain care is delivered. I'm your host, Dr. Joe Tatta, CEO of the Integrative Pain Science Institute, where we train physical therapists and other practitioners on integrative whole-person pain care. Today, we have a truly exceptional guest joining us, Dr. Rose Schlaff. Rose is not just a doctor of physical therapy, but a sexual health coach and sexual health fellow with the International Society for the Study of Women's Sexual Health. After years of clinical experience as a pelvic health physical therapist, Rose began to craft her own holistic approach to sexual wellness. Driven by a passion to empower individuals, particularly women and queer people, she created her own transformation program called Be Well with Rose, which empowers people to harness the power of their pelvic floor, their breath, and their nervous system for healing. Rose's approach is not just about physical therapy. It's about holistic coaching and somatic techniques that help her clients feel more confident, connected, and carefree in all aspects of their relationships. Whether working with individuals, partners, or small groups, Rose provides guidance that transcends boundaries both in geography and in the bedroom. But that's not all. Rose's impact extends beyond her coaching practice. She's also a guest lecturer for prestigious institutions like the University of Michigan and San Diego State University, where she shares a wealth of knowledge on human sexuality. You'll also find her gracing the stages of conferences such as Sex Down South and the American Physical Therapy Association's Combined Sections meeting. So if you've ever wondered how a trauma-informed approach can change your understanding of pelvic pain and sexual wellness, you're in for a treat today. But before we dive in, don't forget to subscribe to the Healing Pain Podcast and leave us a review on your favorite podcast platform. Okay, then without further ado, let's begin and let's get started and welcome Dr. Rose Schlaff. Hi there, Rose. Thanks for joining me this week.
Hi, Joe. Thanks for having me.
I'm excited to talk to you about pelvic pain. We've started to explore pelvic pain more and more over the last couple of months, but I know you have this other really unique interests and way that you help people around their sexual wellness, which, as far as I'm concerned, everyone's interested in their sexual wellness at some point, and optimizing that and learning more about it. I think the place to start is, let's just talk about kind of pelvic pain a little kind of more broadly for a minute, because obviously as a pelvic health physical therapist, you often see pelvic pain and people looking for, help with their pelvic pain. But there are also a lot of barriers that people come up against when they're looking for pelvic care in general. What are those barriers that you've observed in your practice?
Yeah, great question. Thank you for asking. So I think that this is something that is more common than people realize. There are some stats that show women and people with vulvas, 3 out of 4 people will experience pain with penetration at some point in their lives. And then about 30% or so continue to have pain. And really, I think the biggest barrier is the lack of education around sexual wellness for healthcare providers. Really, people are going to doctors. They don't know which doctor to really go to. They think maybe gynecologist might help them, maybe primary care might help them. And when they get there, there's this lack of understanding of how can we best diagnose this? What are the resources to get them to? I can't tell you how many people have told me, yeah, I went to my doctor and they just told me to relax, or they just gave me some lube, or they told me that my only option was a Botox shot, or, have some wine, maybe try that. And it's really disappointing. And I think it really does harm. And especially when we're talking about populations that already may have medical trauma, populations that are less likely to reach out for medical care, like the queer population, trans, non-binary folks, people of color. These are the times that this is really extremely detrimental as well, because of all the barriers it even took to get to the doctor's office. And then on top of that, not getting the care you need. And so I'm so happy you're talking about pelvic pain more so that people can understand that sex, gynecological exams, it doesn't have to be painful. And not only that, it doesn't have to be scary and traumatic. It can be much more easeful and, from a sexual perspective, pleasurable, fun, enjoyable, even if you have a history of pain and even if you're still on your pain journey. So I hope that people listening today get a lot out of this and are able to recognize, okay, this is when I need to go to physical therapy. This is when I need to reach out and get some support here. So,
yeah, it's interesting because I think that some of the circles that we move in and out of, obviously we're talking about chronic pain, more generally, and then we're talking about different parts of the body that, let's just say, suffer when you have chronic pain, so to speak. Yeah. And people are becoming more aware of it, right? Like we are being effective in raising awareness around it. But even with that, I think the biggest barrier that I hear from people is, I'm aware I have this problem. I know I shouldn't have pain when I have sex, so I shouldn't have pain down there, so to speak, with urination and other functions. Yeah. But how do I start to have this conversation with my primary care doctor? Or how do I start to have this conversation with my gynecologist when they've never asked me about my pelvic health or my sexual health before? What kind of recommendations do you have for your patients?
Such a good question. So I like to write things down before I go into a medical office. Even as a medical professional myself, these are intimidating settings. Things are moving really quickly, especially if you're an insurance-based situation. And most of us are relying on insurance to get our primary medical care. And so it can feel like a whirlwind, and it can feel like there's no time to even get it and word in edgewise. And so I like to have it written down as my primary concern. And I like to say right off the top, there's something that I'd like to talk to you about. I'm having some discomfort with gynecological exam and intimacy. And I know that there are some resources in pelvic floor physical therapy or otherwise. Could you give me a referral? A lot of medical providers won't offer pelvic floor physical therapy, even if you say, I'm having pain. So just having, one, this is what's going on. Two, please give me a referral to the place that I want to go can be very helpful.
Yeah. And a big part of what we do is helping people really advocate for themselves in some way, right?
Absolutely.
Yeah. And I think for some people who have had pelvic pain for so long, I think, because you mentioned medical, I want to just slow down for a moment and just sit on medical trauma for a minute. Because in the world of chronic pain, there's so much talk about early childhood events, which are extremely important. However, we don't talk about medical trauma that happens every single day with our patients and people with chronic pain, because they're seeing multiple physicians, multiple therapists, multiple providers. Some of them are very well versed in a modern approach to pain, and others really are functioning on a very old frame, shall we say, with regard to pain. So, one, should a pelvic exam hurt someone? Let's say, is that normal? Is it normal to experience pain during, let's say, a pelvic exam? And then two, because people are scared, they have had trauma before, do I have to have my pelvis or parts of me examined, so to speak, if I'm struggling with chronic pain?
Yes, I'm so glad you're asking this question. So the first answer is no. And I also want to model some language that you can use with your provider who might be pressuring you to have a pelvic exam, perhaps for a pap smear. And there are real medical reasons to get pelvic exams, right? And so if it is indicated, and if you do feel like, okay, I've waited a long time to get a PAP, I've never had a successful PAP, or maybe the last time I had a PAP, it was really painful, or maybe I don't want to go to pelvic floor physical therapy because they put their fingers where, and I don't want to have another pelvic exam. So the language that I like to use here is telling your provider, I have a history of pain, and my body will guard during this exam. Something that will help me is if you tell me exactly what you're going to do before you do it, and if you ask my permission before each step. So instead of, okay, we're going to stick the speculum in now. All right, boo, 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 here we go. Bing, bang, bong. Instead saying, all right, are you okay with me putting the speculum in? I'm about to do that. Is that okay? Yes. All right, then you proceed. Additionally, I'll also have patients or clients even say, if I tell you to pause, I need you to pause and let me take deep breaths here before we continue. So having this kind of emergency plan ready before we even get into the pelvic exam, before we even expose our bodies to that, can be really helpful. So I wanted to make sure that people had that language, that modeling, so they can take that with them if they are needing a pelvic exam. As far as pelvic floor physical therapy goes, I saw you open your mouth. Do you want to say anything?
I was going to say, people could, of course, rewind and listen to those two questions again. But why don't you just give us those two questions again? Just because I think when people hear things more than once, it really helps them realize that this is important and I can actually use this during my healthcare, basically.
Yeah, absolutely. So and again, keep it on a note on your phone. It's high stress, especially if you've had pain in the past, especially if you've experienced discrimination, medical trauma, all of these things. It makes perfect sense that you're feeling anxious in these environments. There's nothing wrong with you. Let's give you some tools so that you feel better supported in this situation. So take out your notes and write, I've had pain or discomfort in the past. What would help me this time is if you explained everything clearly that you're going to do before you do it. So 1, I need you to explain everything before you do it. 2, I need you to ask me permission before each step of the process. Mm-hmm. Not just before you touch my body, not just before you insert. Each step, I need you to ask my permission. And then 3, if I am experiencing discomfort or if I need to pause, I'm going to say the word pause. Or if you're somebody who gets nonverbal when you're in a traumatic situation, you can use a hand tap, a pre-discussed motion, right? I'm going to hold up my hand and stop. Or I need you to talk to me throughout. And if I stop answering, I need you to pause because that means I'm dissociating. Right. So give your provider, it's unfortunate that the burden is on the patient. It should not be that way. The burden should be on the medical system to give trauma-informed trainings to our providers, but we are failing.
Yeah. I'm glad you said the medical system, because as you're talking, of course, we're talking about pelvic health today, but everything you just said works well with people who have pain and or trauma in any part really of the healthcare system, right?
Absolutely.
I mean, just I went to the dentist last week, which, dental procedures sometimes involve a little bit of discomfort. Yeah. And I know my dentist for a long time now, and he knows a lot of the work that I do. So we have a good line of communication, but I was thinking back that wasn't always that way necessarily. And it's a much easier experience when the lines of communication are there. Yes. When there's some space to create a pause or to explain things so people know what's happening, what you're doing, what you're discovering in someone's body or on their body, so to speak. So all those are really wonderful. Okay, so the second part, sorry, I went on a little bit of a tangent there.
No, I love tangents. It's the juiciest part, right? Yeah. So second part that I want to just make clear to everyone. If you hear this and you're like, okay, I do want to find an in-person physical therapist, or I do think that I want some support outside of a gynecologist or outside of my primary care, even if my primary or my gynecologist isn't sending me. If you are going to see a pelvic floor physical therapist, or for example, for me, I don't work in person anymore. So if you are seeing someone, I want you to know that it's not important at a first session, maybe ever. Sometimes it's helpful, at some point, but I've had many people heal completely from pelvic pain without any internal pelvic floor work. And whether that's when you're working with an in-person provider or somebody through telemedicine or coaching, it's important to know that that's possible, because I think there's a lot of coercion that happens in the medical system that is well-intentioned. right? We want people to heal. We want to give them what they need, but sometimes that's more detrimental for the nervous system because we know that the pelvic floor, just like your upper traps, are some of the most protective muscles in your body, right? When we're shown threatening movies, stimulus, those are the two muscle groups that contract first to protect us. So we know that the pelvic floor is a part of a general defense mechanism. And so if we are terrified of internal work, it's going to create this really dangerous pattern that's hard to get out of. So I think that the thing is we have to reestablish safety in the nervous system. And it's more important than even treating the tissues locally, I believe.
Right. And when we establish safety, then we can move on to other types of experiences that are part of our pelvic health, like desire, which I know is one thing you like to talk about. Why is this topic of desire important to bring into the general umbrella of pelvic health? Absolutely.
So desire is so important because it plays into that safety, that fun, right? When we want to do something, it feels completely different than when we don't want to do it, right? We've all had those days where we're excited to go to the gym. We get there, it feels good to move our bodies versus the days where we're really dragging and we're like, oh, I know it's good for me to go to the gym. I know I'll be happy when I get there. But the amount of emotional resistance that you have to overcome to get to the gym that day is exhausting, even if it's a positive experience at the end. And this is what I hear from clients all the time, that pretty much every time they have sex, it's that experience, that second gym experience where I know I'll feel good. I know this is good for my relationship. Oh, I'm exhausted. I'm really pushing through. This is a chore on my to-do list to check off. And when we think about what that's sending, that signal to the nervous system, it's not creating that reward system of this is fun. This is easy. Let's do this again. It's creating a lot of external resistance, and even emotional threats can have that same threat response that trigger the pelvic floor, that trigger other processes in our physiology, like fight and flight, even on a small scale. And if all of our blood is flowing to our heart and our lungs because we're in a stress situation, our brain is like, we're running from a tiger. Why would we use our valuable blood down at the genitals? That doesn't make any sense at all. Why would we bring a baby into this situation and make you horny? This is not the time. We need to survive. So it's important to talk about getting to a place where sex is actually fun and desirable, not just pain-free, which I think when we medicalize sexual wellness, that's where we get to. We say, okay, sex has been painful. Now you're 0 out of 10 pain. Okay, you're discharged. Onwards. And there's a lot of other stuff going on, interrelationally, emotionally, nervous system wise, that we need to address to truly be well.
So ideally, the goal is always, our goal, ultimately, if we're able to, is to help someone be 100% pain-free, right? Like we all want that. Like we want that for our patients. We want that for ourselves. Sometimes it can be difficult though, because there are certain conditions that are chronic.
Yeah.
People have different physiologies and different nervous systems, as you're talking about, and things change. So a lot of factors, sometimes lifestyle factors, sometimes genetic factors, sometimes structural factors. I guess the question, with all of that in mind is it possible potentially to be someone who lives with some chronic pain, but to also have a very fluid and sensual and desire-filled sex life at the same time?
Absolutely. It is so possible. And I think there's 3 key pieces here that we need to address. And most of us don't get the information that we need about sexual wellness growing up. I know I certainly didn't. And I grew up in a really open family too. But we don't have the information. And so I want everyone listening to know that what we see on TV, what our understanding of desire is, which is like, you look at your partner, oh, they look hot. Oh, okay, now I'm in the mood. Let's go. That is very rare for most of the people I talk to.
Mm-hmm.
Very rare.
Meaning I just look at someone and I'm sexually aroused and we're ready for intercourse.
Right, right. Especially in a long-term relationship,
Yeah.
especially if you are somebody who has experienced pain. And on top of this, what is very common and pretty normal actually is more of what's called responsive desire. And when I talk about responsive desire, imagine you've just eaten lunch, you're not hungry, your friend invites you over for food, to hang out, they're cooking food and they offer you some. You're like, no, I just ate, I'm good. You're not in the mood. You smell their food cooking. It smells absolutely delicious. The friend is super chill. They're not pressuring you. And once you smell that food, you're like, wow, okay, I am going to want some of that food. It actually smells delicious now. So your sensory system leads, and then your brain, then your desire follows. Now, it's an important piece of the puzzle. There are two main barriers to experiencing that responsive desire of, like, I call this smelling the cookies in my coaching, right? Like, okay, what helps you smell the cookies? That's one piece of it. Erotic novels, connecting to your partner, eye contact, chore play, where your partner actually does all the chores for you. You don't have to, you don't have to do anything. The house is taken care of. There's all different kinds of things that help you smell the cookies, so to speak. But the two pieces that are key here that block us from smelling the cookies are, one, pressure. And this can come externally, but more often than not, it's an internalized pressure, and it's internalized from a lot of the patriarchal BS that we are exposed to: intergenerational trauma, religious trauma, lived experiences, media, unrealistic expectations of beauty standards, racism, sexism, all these isms that we live with in the world that filter through our subconscious. And then we have this thought, oh God, if I was a good wife, I would have sex with my partner 3 times a week, once a month, whatever the number is. But we have these shoulds that pressure us to act.
It should be this way. It should look this way. It should always perform this way.
Yeah, there's something
wrong with me. It should always feel this way.
Yeah.
Right.
Why can't I stop doing my grocery list in my head while we're having sex? Why aren't I in the mood when I see my partner? Are we not in love anymore? Am I broken? Do other people feel this way? All of that creates that internalized pressure.
If I can't get an erection this one time, is there something wrong with me?
Yeah. If I last too long, if it's too short, right? What's the perfect amount of time? It's like, we can't win. None of us. We're all impacted by these beliefs. And it's worse because, especially in our sex lives, there's no normalization. There's no talking at the dinner table. And just like if you had a hurt shoulder, your family would be like, how's that shoulder going? Are you back to playing tennis? Right. And they know, oh, this is something that's really impacting your life. You can't really openly talk in social situations about, oh, I'm having a lot of pain and it's stopping me from having enjoyable sex with my partner. It's really creating an impact on our relationship. You're not going to talk about that at the dinner table. And so you feel very isolated and alone. So that's one piece that blocks us. And then the second piece that blocks us is a nervous system that just isn't able to switch. And I know you talk about the nervous system a lot on this podcast. I know all of the listeners are aware of this, but we really have pushed that active part of our nervous system to get shit done throughout the day and, check things off our to-do list, be productive. And it's hard at the end of the day to shift out of that go sympathetic drive into that more parasympathetic, relaxed, restful place that is actually oftentimes needed to be fully present in our body, and even tap into our desire in the first place. So I want people to have that information. That's something I wish we all learned early on. And most of the people I talk to don't know about responsive desire. So I think it's such a key piece to the desire puzzle. But this applies to things outside the bedroom too, right? We talked about the gym. what helps you smell the cookies for the gym? Is it putting your gym shoes right there? Is it a gym playlist that you love? Is it, what are your pressure pieces for the gym? Is it, that you feel judged at the gym because everybody is super fit and looks a certain way? And, all these things can play into other areas of our life, but they're super important in our sexual wellness and overcoming pain in our sex lives.
I love these two things because, again, there are two things that people can focus on and take away from today's episode. So responsive desire.
Yeah.
And then your nervous system state, basically.
Yes.
Obviously, the two are interconnected in some way.
Absolutely.
Nervous system state, we have to learn about what the nervous system is. We teach people about things like hyperarousal and hypoarousal, and, we help them learn to modulate their nervous system. Is it easier to help people with the first part, to help them create that environment where they feel safe and more likely to experience arousal and desire?
So anytime you work on safety, you're impacting the nervous system, which So it's all impacting the nervous system, right? It just is a matter of how nerdy you want to get with it. And so, I have some of my clients doing eye exercises to impact their nervous system, and we go down that route. But I have some of my clients who I say, safety is really key to tapping into responsive desire. And the way that we understand safety is by using your body and using pleasure as a compass. And we'll do this activity where we tap into what are the things that feel 100% great. These are the green activities, right? Where if somebody wanted to give me a shoulder massage pretty much anytime, somebody that I knew, I would be like, yes, 100% yes. You probably don't have to ask my permission. If you wanted to, great, but I'm probably going to be fine with that. A stranger, maybe not, but somebody I knew and trusted. Those are the green items. Those are the 100% safe items, right? Whereas a red item is something that is 100% no. And for a lot of people with pelvic pain, penetration is actually a red item. And a lot of people have been pushing through because there's been no example of the fact that you have permission to stop. You have permission to take penetration off the table for a little bit of time or forever, right? And I think that's so freeing for people because there is such a societal expectation that successful sex equals 1, penetration, right? Very heteronormative. And 2, it ends in orgasm for both people. And so there's so much pressure surrounding that. And hopefully you're orgasming at the same time, just like we see it in the movies, because if not, you're probably broken, right? It's like so unrealistic. And so allowing people to redefine, what does successful sex look like to you? What are the things that your body feels are 100% green? And can we have a period of time where we just do those things? And then we'll paint. I don't know if you ever do this with your, in chronic pain people, but sometimes we can paint non-painful sensation. I oftentimes paint with pleasure with my clients. So it's like, okay, if your knee is pleasurable to touch, but when we get halfway up your thigh, it's starting to feel like a yellow zone, right? Yellow is like, it's not 100% red, but we're getting close to a red zone. I'm a little hesitant. I'm starting to feel my body tense up. I'm starting to be nervous about where this is going to go. And so can we use that green and little by little inch and paint with the green into the yellow zone to make those yellows more green?
So you mentioned the idea of heteronormative sex.
Yes.
Which I think we probably should define that for people so they understand it. And
yes.
You mentioned the LGBT community in the beginning of the episode, which I appreciate. And we're heading into kind of LGBT Pride month here in the United States of America in various cities. And my experience, because I am gay, is that in general, the LGBT community will explore sex in other ways besides just the one way that we always see on TV, so to speak. Yes. And to be quite honest, there's a little bit of fun that can happen with that. Yes. And desire, as you mentioned, and it's healthy. It's a normal part of our human sexuality, as they say.
It is.
How does a heteronormative view potentially get in the way of desire for other groups of people?
Absolutely. Yeah. And as a queer person myself, I'm like super excited that we're spending time on this topic. It's so important. So I think that heteronormativity is what we have seen oftentimes in the media, and media representation is getting better. But when I was growing up, it was very straight, white, skinny, right? Like everybody looked one way.
And funk and had sex one way too, right?
Exactly.
Which
Exactly.
typically means the man on top and the woman on bottom in a traditional missionary position.
Right. And everybody orgasms every time at the same time. Right.
Right. The exact same time every
It's
time.
just miraculously, you know,
Right.
oh, that's not how it works for you. Oh my, well, everybody else is having simultaneous orgasms everywhere in the world. If you are listening to this and you cannot pick up on sarcasm, please know that I am joking. But yeah, so I think that there's a focus on penetration. There's a disconnection from the process of intimacy, the process of pleasure, and exploration. And what I love about the queer community, the LGBTQ community, is we already are outside of the mold. So we kind of have to be creative with every part, right? Like how our relationship looks, how our families are going to look. Everything has to be creative because it's not what we've seen modeled for us a lot of the time. And so that's why I refer to this goal-oriented sex as heteronormative. And I think that there are many heterosexual couples that have, you know, sex that doesn't look like that, right? And
Sure.
are exploring these things. But I think it's that goal-oriented sex where we've checked the box, you hit home base, so to speak. You've got, you know, you had penetration. That's the end goal. That's the end goal of everything. And then the end goal of the end goal is orgasm. And so I really encourage people to let go of those two definitions that I think are rooted in heteronormativity, and, you know, let go of the fact that we have to immediately be doing penetrative activities and explore more of just what feels good. I define successful sex as I'm connecting with myself or a partner, and I'm feeling good in my body, right? That's it. That's the only thing I need for success. And I have every coach and client answer that question. What does successful sex look like to you? And this is a way that we can begin to shed those heteronormative, patriarchal, you know, definitions that aren't even ours to begin with. It's just the only example we've seen in most porn and in most media. And we start to really think about, well, what's my favorite part of the sex that we're having? What are the parts that I'm kind of interested in that we've never done before? What might that look like? What are the parts that make me feel pressured? And a lot of the time, orgasm is very pressure filled for people.
Mm-hmm.
And sometimes I'll have people just take orgasm completely off the table. I'm like, okay, your homework is to connect physically with no penetration and no orgasm.
Mm.
And like, if it happens, there's no slap on the wrist, right? It's like, okay, added bonus, but it's not the goal.
So we talked a lot about things that people can do, and we're starting to kind of move into the realm of what people should kind of stop doing, right? So I think one that we just spoke about is this idea of, you know, just to say letting go of a completely heteronormative approach to intimacy and sex, right?
Yeah.
What other things should we just kind of just stop doing, so to speak, or do significantly less of it?
I talk about this a lot. There's a lot of pressure on what I call gourmet sex. So people have this idea in their mind of
gourmet sex. You know, it sounds, I want to get out like some whipped cream and cherries, but now I'm interested in what gourmet sex is.
So it's perfectionism in the bedroom, basically. Yeah. Right. And and just like perfectionism in all parts of our life, in any healing journey and all areas of personal development, it stops us from action. And so if we say to ourselves, every time that we have sex, I have to be perfectly in the mood before we even think about it, before you even look at me. Every time we have sex, we have to, hit these goal markers. We have to have 45 minutes of foreplay. We have to, stare at each other in the eyes for 30 minutes, right? Whatever. And I'm not saying that those are bad things. And I do think that setting aside significant chunks of time just for, to have that time and space to connect is important. But I think there's a balance. I think it's also nice to have some fast food moments, which is funny that I have this metaphor because I eat so clean. I'm like, but I think it's another way to take the pressure off, right? Just how can we take any pressure off of ourselves of how this has to look? And maybe that's, I really feel disconnected from you. I really want to connect with you. I'm exhausted. It's the end of the day. I don't have the energy for sex. Could we, spend 5 minutes and just, hold each other? Or could we take 2 minutes and I'll give you a massage and then we'll swap, and then 2 minutes and you give me a massage? Or could we just put our phones down and make eye contact and put our hands on each other's chests and breathe for 1 minute? Right. And so there's these little like intimacy snacks, little fast food moments of getting something intimate, something connected that isn't sex. That isn't the gourmet version. I'm not knocking the gourmet version. I'm just saying it doesn't have to be that all the time. And also, if you ate your favorite food every single day, probably get sick of your favorite food. So variety is nice.
I love this because it really makes you think about the entire process and the experience and what that's like, instead of, as you mentioned, the end goal, so to speak,
Yes.
that people think about. And it also makes me think that this process doesn't have to be the same all the time.
No.
And the experience doesn't necessarily have to be exactly the same all the time. Like, pleasure exists on a continuum, right?
Yes.
There's lots of different colors and hues within a pleasurable experience, including a sexual experience,
Yes.
potentially including if you have some type of pelvic pain condition, so to speak.
Yeah. And this is important, especially important if you are somebody who has pain or if you're somebody who has a cycle, right? We are different with somebody with a menstrual cycle. I want to clarify, emotionally, physically, we are in different places at different points of our cycle. If we are somebody who has chronic pain, we may have high symptom days, we may have low symptom days. And so the things that are going to work for us on one day may not work for us or even sound good on another day. And it just normalizes that flow of being a human. And I think any human, right? Like, we're never the same any given day. And it doesn't mean we're, quote unquote, not our best selves, but it's finding that pleasure, finding that joy, finding that deep intimacy at whatever season you're in, whatever energy level you're in, whatever emotional state you're in. You can still stay connected to your body and you can still stay connected to your partner and take any pressure off of what it should look like. You get to decide what it looks like, and you can build that by just following the pleasure.
I just want to give a quick nod to professionals, because we've been talking kind of more, globally about pelvic pain and pelvic health and sexuality. I know you do some work with practitioners and you interact with a lot of clinicians. What's the one thing that you feel is kind of missing that you really try to impart on new professionals who are coming into this area? Like this one kind of like, the one tidbit that you find to be most impactful to their practice, which then obviously affects their patients and clients.
Yeah. I think as many new grads, myself included, when I was in that place, I think a lot of the time we are trying to prove how good we are as physical therapists by, quote unquote, fixing our patients, right? And I think sometimes, depending on what setting you're working in, especially if it's an insurance-based setting, there's a real sense of urgency, time urgency. And so we're like, let me fix you quickly. Let's go, let's go, let's go, let's go, right? Do this dilator, do that dilator, on to the next one. You're not doing your homework. What's wrong with you? You're quote unquote non-compliant. Mm-hmm. And just from what I understand about the nervous system and healing in general at this place, I want providers to understand that the baby steps can be so much more impactful than throwing the kitchen sink, going fast, giving all the resources. And I want to give this example of when I was in the clinic. Anytime I would do a pelvic exam with somebody who had pain, I would ask them. Sometimes I've seen with past patients who've had pain that doing a visualization and a grounding practice before doing internal work can be really helpful because it grounds your nervous system and it relaxes your body. Is that something that would feel helpful for you? Is that something you want to explore? And if they said yes, then we would do it. It doesn't have to be long, but it would be a grounding. You're safe. You're exactly where you need to be. Thank your body for protecting you and keeping you safe. Pain is a signal to do something different. And anytime there's pain in the body, it's a sign that it wants something different. And so you can thank your body for bringing you here and letting you know that something different needed to happen, and let it know that this is exactly where you need to be. And so just taking that moment of eyes closed, breathing, and sometimes I would do a progressive muscle relaxation with them, sometimes not, but tuning in. I think it's so easy to dissociate when you are somebody who has chronic pain of any kind. And so coming back to your body as a place of safety is like the best first step that you could walk with anybody on their journey. Because we're not doing the healing, right? We are just privileged enough to walk with somebody on their journey. And so if you can walk with them on the journey back to that safe place in their body, you are doing more for them in the long term than any dilator work, anything else. And then just as a tidbit, I think vibration is always a great option for pain interruption, for adding pleasure, right? Any type of homework you're giving somebody with pelvic pain, add a vibrator. Always, like, unless they are somebody who feels threatened by vibration. But it's something that I've found very, very beneficial to disrupt pain signals and improve pleasure. Right? Demedicalize this thing that, we have to medicalize it in certain ways, right? For patient safety and comfort. But when they're at home, like, take the medical out of this. Have fun with it.
Rose, it's been great speaking with you today about pelvic pain and sexual wellness. I know everyone will really enjoy this episode. They have a lot of good information to take away and probably had some fun with this as well. I appreciate you being here. Let everyone know how they can learn more about you and follow your work.
Yes. Thank you so much for having me. It was so much fun. So you can find me on Instagram at Be Well with Rose. If you're listening to this and you are taking something away, I love hearing that from people. So please shoot me a direct message. Let me know, what are you taking away from today's podcast? You can also find me www.bewellwithrose.com. I offer free 20-minute phone calls for any clients who are feeling like, okay, I've maybe potentially had pain in the past, or maybe currently have pain. And now the type of work I'm doing, I tend to collaborate with in-person physical therapists, and we work together, we co-treat. So I bring in more of the coaching, more of the nervous system, more of the, how do we make sex fun and easy again? While you're getting that hands-on work from a pelvic floor physical therapist. So if you're a pelvic floor physical therapist listening to this and you're like, I would love to collaborate, I'm looking for pelvic PTs all over the country because I have clients all over the country. So please introduce yourself. Like, I want to find the good people. And then there's also some free resources if you go to the link in my bio on Instagram as well. So thank you so much for having me.
Great. So all really easy to follow, bewellwithrose.com, or you can just go to Be Well with Rose on your favorite social media handle. At the end of every episode, I ask you to share this with your friends and family and coworkers on Facebook, LinkedIn, Twitter, Instagram, wherever anyone is talking about treating chronic pain, treating pelvic pain, or if they're interested in sexual wellness. I'm Dr. Joe Tatta, and I'll see you next week. Thanks for being here.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's integrativepainscienceinstitute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.